Namrata, you can start. Okay.
Good evening, and I heartily welcome to all present over here. I, Namrata Padkiri, shall be the host for today's session. So here I am with another webinar session on community health with Enajori. So first of all, I would like to give a brief introduction about Enajori. So Enajori, as the name suggests, its literal meaning is the bond of love. Milindatta is the founder of Enajori, and it is his unconditional love for his native land which brought him back from USA to Assam again to work on a non-profitable organization which engages and promotes various initiatives such as uh, leadership skills, striving for social change, and also building entrepreneurship capabilities among the people living in Northeast India. So, for the couple of months, we have been in engagement with various speakers from different regions of Northeast India, and we have sort of tried to create awareness among the people about certain very significant and important topics of today's generation, of today's present day. So, coming back to today's session, uh, I would like to tell you today's topic of discussion. It's a talk on it's a talk on addictive disorders. So here today we have our guest among us. His name is Dr. Dhurbajyoti Bhuyan. He is an associate professor of psychiatry in Assam Medical College and Hospital in Dibrugarh. He has primary interests in mental health, anxiety, depression, and behavioral disorders of childhood adolescence. He also loves helping people towards their optimal mental health. And he has been awarded with awards such as Dr. Bhimrao Ambedkar Award in 2019, then Best Young Faculty Award in 2018, and then Vikas AwarlaAward in 2017. So, welcome, sir, to today's session. And now I would like you to take over the screen. Please, sir.
Okay, thank you so much. So at the outset, I must thank the organizers for giving me the opportunity to share my thoughts about addictive disorders. But before I start, let me give a very honest disclaimer that being a psychiatrist and being a doctor, doctors are usually the most boring creature on the earth. So probably you will have to bear with my boring kind of deliberation for half an hour or so. So please bear with me. And the person who is delivering this might be boring, but the subject is not boring as such because it is a very pertinent and burning topic. Because nowadays, everywhere you will come across certain people who are being suffered from addictive disorders, may it be substance addiction, may it be certain behavioral addiction. Now, let me make the things very clear that what is addiction or behavioral addiction or chemical addiction? We in general call it as dependence actually. Okay. Now, there are many myths regarding these disorders, and people always think that those who are addicted to certain substances or behavior, they are basically mentally weak or they have got certain flaws in their character. But let me make one thing very clear that these are the people who are suffering from a medically sanctioned disease. Addiction is a disease. How it is a disease, let's talk about that. See, every one of us have got our own interest, own likings, own dislikings, and these are being controlled by our brain. Whatever we think, whatever we behave, how we feel, how we perceive things, how we judge the situation, all these are controlled by our brain, and brain controls it through certain neurochemicals. different areas of the brain have got different functions, and one such area we call it as reward center. There are different areas of the brain which are incorporated or included in this reward center. I won't go into details of all those medical jargons because it will make my deliberation more boring. So I should attempt to reduce that boredom. So whatever we like it, that suppose you are fond of music, then whenever you listen to music, your reward center is stimulated and neurochemical is secreted from that area. And this neurotransmitter, we call it as dopamine. Suppose you are fond of certain foods or certain kind of cinemas, and when you are into that, your reward center will be stimulated and you will enjoy it. There are certain group of people who won't feel that kind of enjoyment in normal pleasurable activities. Their basic defect lies in the reward center. So what happens? So when they take these substances or any kind of behavior such as taking his or her mobile phone and playing games, these will stimulate his or her reward center, and as a result of which there will be excess secretion of dopamine, and that will give them the pleasure, and different areas of the brain will remember this event, that if that person is looking at or doing that activity, it is producing some amount of pleasure. Okay, that pleasure, in our term, we call it as kick. If you are fond of Salman Khan's movie, then you know that term kick because it was his film. Okay, but the thing is that when the person gets that kick, there is another area of the brain which we call it as prefrontal area, and this lies there only here. And all the importance to any kind of event is given or attributed by this area. So this area will give significance to that event, that taking a substance will give me pleasure, or playing video game will be pleasurable. So importance will be given to that event. And a time will come when other areas of the brain will be activated, which will lead to repetitive behavior. Every time I will want to do that behavior or repeat that behavior. So it becomes a pattern or a repetitive behavior, and we call it as a disorder. And this is, in nutshell, addictive disorder. Okay. Now, addictive disorders can broadly be classified into two groups. One is the chemical and other is behavior. Chemical, we call it as drugs or psychoactive substances. We doctors call it as psychoactive substances, but nowadays it is the era of WhatsApp and SMSs. So we will cut short that long name psychoactive drugs or substances. We will simply call it as a drug. Okay, why these are called psychoactive substances? I said brain controls our behavior. So when these substances are taken, it will change the way we are thinking, it will change the way we are behaving, it will change the way we are feeling. So that means it will change our psyche or the mind. So therefore, these are known as psychoactive substances, and it can be anything. Starting from alcohol, most of the people, when at your age, somebody says that I am into drugs, people usually think that it is something like powders and all those things or injections, but even alcohol is a drug. Okay, anything which contains ethanol is alcohol. Many people have got this kind of myth that alcohol, what alcohol is or alcohol is not a drug. Often we encounter certain people when we ask them, do you take alcohol? They will say that, no, I am not taking alcohol. But if you ask, do you take locally brewed alcohol like Haspani or Apong, something like that, or beer? They will say, yes, sir, I take one can of beer, but I don't take hard drinks. See, whether it is beer, whether it is Haspani, Laopani, Apong, anything which contains ethanol is alcoholic beverages. Only the concentration differs. Okay. Number 2 is your opioid group of drugs, where your afim or the kani. In Assamese, the people usually used to say that kania ahomia. That means this is actually, kani is derived from the poppy plant. And there are certain medicinal use of this, like morphine group type of drugs. Then some are naturally occurring and some are synthesized in the laboratory. These are like heroin or brown sugar. Then comes the cannabis containing things like bhang, hashish, saras, ganja. All these are different preparations of cannabis. Then comes your certain drugs like nicotine. Now, nicotine is used in two forms. One is your chewable and other is smoking form. Okay. The smoking form cigarette we all know, but smokeless, at least starting from our tamul and pan, where we take nicotine sada in that and we take it. Okay. Therefore, I often say, if Amul is the taste of India, then Tamul is the taste of Assam. Then Khaini, Gutka, and nowadays people are well versed with certain like Panpara, KP, and people used to say Bolo Juba Kesri, even that is your nicotine containing product. Then certain medicines which are being used either to induce sleep or to decrease sleep. These are sleeping pills. Then those who will produce alertness are amphetamine type of drugs, which are often abused by the people where they need to be alert, like before the exam, like before a game. So these are certain group of drugs. Then, of course, recently some other drugs have been added which will produce hallucinations. Means, what is hallucination? It is a perceptual disturbance. Now I am talking to you, you can see me, but suppose I am not here, but still you can hear my voice, or still you can see me. Then this is we call is as hallucination. There are certain drugs which, when taken, will produce that kind of experience in them. These are hallucinogens. Then often school-going children, they are seen to be addicted to a particular kind of substance, that is glue or petroleum kind of products. We call it as volatile substances. Okay. Like many people you have seen, they have used whiteners or petrol, shoe polish, even certain glues. I am not going to name them, but these are also quite addictive things. Okay. Now, somebody might have this thought in his or her mind when I am talking that certain medicines, because I said some medicines which can produce sleep and some medicines which will produce wakefulness. That is, then some people might think that why these are medicines? That means these are being prescribed by the doctors. Then why these are classified under drugs? There is a very thin line between use, misuse, abuse, abuse or harmful use, or dependence or addiction. Suppose every day we are taking tea or coffee, it contains caffeine. Okay, fine. Caffeine is a stimulant. Suppose you are having severe headache, you are taking painkillers. Okay, fine. Now you are using it and it is not causing you any harm because it is taken in a moderate amount or in a supervised amount. Suppose every day I am taking a cup of tea, I am using it. So this is use. Now, suppose you are having fever, you went to a doctor has prescribed you paracetamol and some sort of antibiotic. He has given it to be taken for a period of 5 days, but you are taking it for a period of more than that. Suppose you thought that I am better by 2 days, and if I take it for 1 month, for the whole year, I won't be having any disease. That means you are misusing his prescription. This is misuse. Now, when you are misusing it, it will start causing some harm to you. Harm might be in the physical harm, psychological harm, even financial harm. Suppose every time you are taking it, it is causing damage to your liver. So you are going to a doctor for treatment. That is also your financial harm. Suppose you are spending more money on that. You are not working. You are ignoring other activities. That is the financial harm. Or even interpersonal harm. There is conflict with the family. A person who is taking alcohol and fighting with the family. That is the familial or interpersonal harm. So any kind of harm, even if it is occurring and person knows that it is causing harm, but still he is taking, at that stage, we will call it as harmful use or abuse. A time will come when he won't be able to leave the substance. I initially said that when a person takes the substance, it produces a kick. Now, a time will come when the amount of drug which he has taken, he needs to increase it in order to get that kick. And if he does not take it, then he will feel discomfort. He will have certain very distressing symptoms. We call it as withdrawal symptoms. If you have seen any person who is taking alcohol, if he is not taking, then you will see that his hands are trembling. He is not being able to sleep. These are actually withdrawal symptoms. Then he will have intense desire to take the substance. That we call it as craving. All his activities he will ignore and he will only think about the drug or the alcohol, and he will take a great deal of time in spending in procuring that drug. Okay, if these symptoms are there, then we call that person is addicted to that substance. Okay, or we call it as dependence. Now take the example of certain behaviors. Suppose your parents have given you the mobile for your online classes. Okay, now you are using that. So I will call it as use, or you have used it to call someone, that is use. But the moment you started using it for any other purposes, like watching movies in OTT platform, that means you are misusing it. Now you are spending more time on that, so that you have ignored your other activities like studies and all those things. So that has become your abuse or harmful use. Now, if you don't be with your mobile, then you are very distressed, you are restless, you are not being able to sleep. All the time you will be feeling bad. Now you have become addicted to it. So this is behavioral addiction. This can be mobile, this can be gambling, this can be any sort of behavior. Okay. Now, if I look into all those things, then I will always say that this is a disorder. So the first and foremost concept that we need to have is that when we have called it as a disorder or a disease, it needs to be treated. But there are many hindrances to seeking the treatment. These hindrances are because of, first is the misconception or myth about this addictive disorder. Three is that once an addict, always be an addict. So there is no treatment for that. Then next is that if he is addicted, doctors cannot treat him. So you put him into certain rehab centers, as if it will be like old saying like that in Bata, if you put some sort of dead cows and all those things, then on the other side, they will make it a beautiful soup. It is not something like that. The myths have to be removed. First and foremost, it is a disorder. To have a disorder is not his fault. People might say that initiation of substance or these behaviors was his choice. So how come it won't be his fault? So let me draw one analogy. Okay, suppose most of us have probably tried pan or something. Somebody are addicted to it, somebody didn't like it, so they are not taking it. That means there is no defect in their reward center. So they have not become addicted to it. Now, people know that taking sugar or sweet after a certain age will lead to diabetes if he is not working properly. But still we are taking sweets, we are taking junk foods. But are we blaming them to have diabetes? No. So then why we are blaming these people? So we need to change our attitude. Okay. Now, number 2 point is that treatment is possible. Now, people will say that I have been to that doctor who has given him certain medicines, he was better, but again he has started it. Remember that treatment is possible, but it is a bit longer. Because I always say, it took long years for Ratnakar to become Valmiki. So it will also take some time, give him some time. Suppose somebody is suffering from diabetes, so you are with him, you are giving all the support to him, but suddenly in one party, he has seen certain jalebis and rasgullas, so he has taken it. What you will do? Next day, you will take him to the doctor, you will get his sugar test done, then you will again strictly monitor him. So same concept we can use here also. If we blame that you have taken it again, then what will happen? There is no use talking to you, you are a gun case. That will give a very negative kind of thing to them. So we need to help them. Number 3 point is that somebody thinks that, okay, if I go to the doctor once, whole of my problem will be sorted out. Remember, he has to come to the doctor repeatedly. We call it as surging of motivation. That means when the person comes to us, we always talk, we always counsel them, we give them certain medicines, and people feel better. See, motivation lasts for some time, then it again fades out. Like your mobile phone. You have bought even a very costly mobile phone. Every day you need to charge it. The same concept arises here. Coming to the doctor will again motivate him. But next thing is to whom he should go. The psychiatrists are the trained personnel to treat addictive disorders. Rehabilitation comes last because I have said the medical model of the treatment. The people always believe that these people are the greatest liars on the earth, because if you ask anyone, any family member of the addicted people, then they will always say that, no, every time he swear by the name of God, swear by the name of his children, but that today is the last day I am drinking or I am taking the drug, from tomorrow I won't take it. But next day he will again take. See, there is again a medical explanation for this. I say that when he does not take the substance or he has taken in a smaller amount, next day he will have certain very distressing symptoms. We call it as withdrawal symptoms. In order to get rid of that withdrawal symptom, he is taking the substance. So bring him to a doctor who will give certain medicines to take care of the withdrawal symptoms. Once withdrawal symptoms are over, then there are certain medicines which will reduce or decrease the craving for the substance, that he need not have to think about the drugs or the alcohol. So his craving will come down. Then there are certain therapies like motivation enhancement therapy, how to keep himself motivated to remain abstinent from these substances. The same principles we apply for behavioral addictions also. Okay. Now, the thing is that addictive disorders are often, it actually often gives a very negative kind of feeling for the family members. they are already fed up because their behavior is such. Because a person who has taken the substance, okay, he probably has started because of curiosity, okay, because his friends were taking. So because of curiosity, he has started taking it. There was defect in his reward center, so he has become addicted. Now, in order to get the substances, he has started spending more money. So now he is exhausted with the money. So what he will do, he will start stealing or he will start borrowing. Then later on, he will start taking lies, telling lies in order to get that substances. So people always have a very negative feeling for this. But we need to understand why the person is taking the substance. For the youngsters who are there in this Facebook Live, let me tell about the career of an addict. That means how a person takes it and how he becomes addicted. The first thing, usually they are experimental users. Under curiosity, they have taken. Then they becomes recreational user. That means in parties or somewhere they are taking it. Then gradually their control will go down and they will become the habitual drinker or user. So they will become addicted. So the first and foremost thing is that to prevent it, we require a multi-pronged approach. Why I am talking it multi-pronged? Because most of you might be thinking, since there is alcohol, stop all the alcohol shops, then there will be no addicts. Or stop the supply of the drugs, there won't be anyone who will be addicted to this substance. It is not that simple. I was the part of a famous study called National Drug Survey, which is conducted from AIMS, and I was the in charge for the northeastern states. What we have found that the areas where alcohol was banned, even we have seen people who are addicted to alcohol. Okay, because demand is still there. Suppose on dry days, there should not be any drink, but what the people usually do it, they buy it one day prior to that. But if you block all the supply, then they will take it from black market. And when there is black market, there is no control. There is no control over that. And people used to take spurious one. So all the intoxication and all the poisonings do occur. So there should be three things which should go side by side. Until and unless there is demand, as long as there is demand, there will be some way of supply to them. So we need to reduce that demand. Then there have to be, therefore, three-pronged approaches: demand reduction, harm reduction, and supply reduction. Ideally, abstinence is the ideal thing. So you need to educate the people so that they do not experiment with that drug, so that they don't become addicted to it. So this kind of webinar is also a form of where we are adopting demand reduction strategies, because now people know that it can cause certain harm, so I should not use it. So demand will be reduced. Those who are taking the substances, you treat them. Again, demand will be decreased. Those where it is not possible, at least we can reduce the harm. That means if the person is injecting, at least if we can prevent that injection, then there will be chances of HIV, less chances of HIV and AIDS. So thereby we are reducing the harm. Then once you treat these patients, now a person who is injecting drug, people regard them as criminals. But the moment you have on that, now he has come to a hospital, now his status has improved, now he has become a patient. So society's outlook has changed. So that is the social benefit that person is getting. So in that way, we can give a positive sense to him. And everyone wants to change actually, but we need to provide them that platform or the opportunity. So if you know anyone who is suffering from any kind of addictive disorder, at least you talk with him, motivate him to go to at least a psychiatrist who will take care of all these things. And nowadays, psychiatrists are not a rare species to find. In most of the district hospitals, there are psychiatrists. So we can treat addictive disorders, we can prevent addictive disorders, but we need to have a very well-organized, coordinated approach. So this is what I had to say all about, but it is not that easy as I am saying, because all the disorders are having three sorts of etiology. One is your biology, then psychology, then social factors. These play a very complex role. Biology, I have already said, the problem with the reward center. Then there is also genetic effect. If the family member is using, then chances of having the addiction is more common in other families. Then how the people are reared upon, how his personality is, that is the psychological factors, and social factors where there is more stress or where there is social unrest. These also contribute to it. One last thing, and you can compare this biopsychosocial etiology into plantation. How it is, suppose we are planting a sapling. One day that sapling should grow into a bigger tree and we should have the fruits. Now the quality of the fruit will depend on three things. Number one, the biology or the seed from which the sapling has grown, that is your biology. The soil where you have planted it, that is your society where you are living it, whether it is fertile or not. And the last thing is that whether you are taking care of that or not, whether you are watering that plant or not, that is your psychology, means how you are taking care of your children, that is your psychology. So these three factors are quite important, and that's why I have said that you always need a very coordinated approach to deal with this biology, psychology, and the social factors. And treatment is really possible. We can modulate certain biological factors. And of course, I have talked about motivational enhancement therapy, then different kinds of counseling and various social measures to deal with the menace of addictive disorders. Thank you. Hope I have not bored you too much. Thank you so much.
Okay, sir. Thank you so much for this information which you have given us. So at first, I would like to mention a few things. The first one is this, that I have always admired the doctors. Since childhood, I have always been fascinated by their profession. So doctors have never been boring to me. And the way you have spoken, it was really very, very interesting, sir. Then second thing is that this is my personal problem. So I am currently living in Tejpur, and the climate is very cold here. So I often tend to get cough or fever very easily. So my mother suggests me to take cough syrups and all. And one thing which I would like to mention is that I love drinking those cough syrups. Like I tell my mom that okay, if I have got fever or if I have got cough, and if I have to take the cough syrup, then this is not a big deal for me because I like consuming them. So it can also be a kind of addiction, right, sir?
Yes, because I have said the thin line between use, misuse, and harmful use. Yeah. And these see, most of the medicines, we are prescribing it, but we are prescribing it in a very limited way or in a supervised way. So it is always advisable that you please consult a doctor before taking any kind of cough syrups, because some of the cough syrups are quite addictive in nature.
So, sir, Second question, which I would like to ask you, that previously while introducing you, I have mentioned about the field of interest of yours, that is behavioral disorders of childhood adolescence. So, sir, could you please brief us about that topic, what it is exactly?
Okay. See, often people earlier thought that children are immune to psychiatric illnesses. No, children do suffer from psychiatric illnesses since they cannot ventilate out, they cannot speak it out, they always express it through their behaviors. Now, you need to understand the behavior of the child. When the child is showing some unruly behavior, we often say that he is very naughty or he is not obedient. But every behavior has got certain message in it. So we need to identify that message. We often label certain behaviors as abnormal or unruly, and we tend to punish them. See, punishment is no way is advocated. There is no role for punishment. Nowadays, we always talk about certain reinforcement, maybe positive, maybe negative. See, when you are applying force on the child will be imitating you. Child knows that my parents wants me to behave in that way. That is their demand. And if I am not following their demand, they will use force on me. So I should also use force if my demands are also not fulfilled. That is number one. Number two, there is a study, actually, there was a study where they have found that when children behave abnormally or unruly, it has got certain meaning. Number one is that you notice me. There's something is wrong inside him. He wants that you notice me, or he seeks attention. Sometimes the parents are such that they are irritating the child. So every time the child shows something which we can view as the revenge towards their parents. Okay. Third is that misguided power. Child is inadequate because physically, mentally, they are not adequate. So how they will make things understand to the others, they will shout, they will behave in unruly way. So this is something like that. So we need to understand that behavior. Then number three is that there are certain disorders where the child will behave in some different ways, like conduct disorder, like behavior, oppositional defiant disorder, like ADHD. There are different kinds of disorders which the child is suffering from. But the presentation varies. Even if a child is depressed, he might behave abnormally. He might be very restless. He might be very aggressive. Even if he is having some kind of your conduct disorder, ADHD, then also child will be very much destructive and he will be very restless. So it is a very specialized kind of field where you need to observe the child, their behavior, and thereby you can help them. Not always they will require medicine, some sort of environmental manipulation, some sort of parent management technique can do the wonder. So this is in nutshell what the behavioral disorders of children and adults.
Okay, sir. So then moving forward, there is a term known as compulsive disorder or compulsive behavior. So in simple words, if we need to define it, then it is like some repetitive action of a particular person who does that thing again and again. So
Yes.
there is a mental illness too. There is OCD.
Yes.
OCD is also a compulsive disorder only. So, sir, is it possible that a person who has OCD can also have a high risk of getting addicted to any substance or non-substantial addiction?
Yes. If you want me to answer in one word, then it is yes. And if you want me to answer in a para, then I will always say that even nowadays new classification is coming up where some sort of compulsive behavior is actually compulsive behavior. Taking the substance is also a compulsive behavior. Addiction is also a compulsive behavior. So it comes into a spectrum. And most of the time, people who are suffering from obsessive compulsive disorder, they do suffer from addiction. Okay, may it be substance, may it be any sort of behavioral addiction. Okay.
Okay. Then, sir,
But
earlier.
remember, another thing is that you need to be very sure. Suppose the person who has got a obsession of being contamination of hands, so he will be repeatedly washing his hands. But though he is doing it repeatedly, it is not addiction because he is not enjoying it. He is just doing it in order to get rid of that thought. But if he is doing it with the mobile, that enjoyment has to be there to call it as addictive disorder. Okay?
Yes, sir. So then one thing which I want to say that sometimes, as you have said, that addiction can be genetical also.
Yeah.
And sometimes what happens that under peer pressure, the particular person does some things which lead to addiction later. So in my university also, I have so many friends there who comes under peer pressure and then becomes addicted to all these substance and chemicals or whatever they consume. So, sir, how can I, being their friend, or if someone is from my family member, can help them with this particular issue without because these people have a tendency of defending what they are actually doing. They do not accept this thing that it is bad for them or it is an addiction. So in that case, how me as a friend or as a family member can approach to them?
See, you can always pass on the message that these are diseases. Okay. Now, there are lots of myths and misconceptions regarding these disorders, basically in all the psychiatric disorders. So you need to be quite patient, first and foremost thing. Number two is that you can talk with them. Then usually they will tell you some of their problems which they are encountering, because people tend to defend or deny their problem. But if you talk with them, then they will always admit that there are certain problems. In that point, you can always offer that you can go to that person or a doctor who can help you. But while doing this, please don't do it while the person is taking the substance, because these are psychoactive substances. It will change the way of his behavior or his thinking. And most of the time there is arguments, because we have found that most of the wives of those husbands who are addicted to alcohol, they always have their fight because the husband is intoxicated, and at that time only the wife is talking ill about alcohol. Okay, so don't enter into a confrontation. Rather, you can talk with the patient or the person while he is not intoxicated. Else, it reminds me of a famous story where this story most of you know, because there are many people who are talking it in different ways, but the story is same. What happens when you argue with a person who is drunk? The same logic applies to each and everyone. Then one Panditji has taken that pain that I will motivate that person to quit alcohol. So he said that I will ask you certain questions, and you please listen to me. These are certain lessons of your life which will help you to quit alcohol. Then he said, okay. Then that Panditji has set for that interview, and he has asked, okay, I will give you certain answers. So you must answer. That person who was drunk, he said that, no, Panditji, you should give me the first chance. I will ask you. If you can answer that correctly, I will leave alcohol forever. Then that person has said, Pandit ji, aap bataiye, is jahan mein sabse bada kaun? Then Pandit has said, Mandir bada. Then this drunk person, he has said, एक बात बताइए, अगर मंदिर बड़ा तो धरती पर कैसे खड़ा? Then Pandit was shaky at that time. He thought, what has happened? Then Pandit said, धरती बड़ी. Then he said, धरती बड़ी तो शेषनाग पे कैसे पड़ी? Then Pandit ji has to change his version and said that शेषनाग बड़े. शेषनाग बड़े थे शिव जी के गले में कैसे पड़े? Then he said that शिव जी बड़े. Then he said that शिव जी बड़े तो कैलाश पेड़ कैसे खड़े? तब वो बोला कि कैलाश बड़ा. अगर कैलाश बड़ा तो हनुमान की उंगली पर कैसे खड़ा? Then Pandit was very upset and he was disturbed. He said, तू ही बता अब कौन सबसे बड़ा? He said, इस वक्त वो बड़ा जो एक पूरा बोतल पी के भी अपने दो टांग पे खड़ा. So don't argue while the person is taking alcohol or substances. But while he is sober, you can definitely talk to him and usually they listen. While you can say that, they might say that I am not having this problem, then you can give certain examples that those people are suffering. Okay, they are having the problem. So you might also be suffering. So we don't want you to be among those people who are having cirrhosis of liver, who are having cancer. So that's why we want you to go to a doctor. Okay, so that will depend on the situation, or it will be very individualized kind of approach that you will have. Okay.
Sir, I would like to ask your opinion. Sir, according to you, what is the most addictive disorder among the teens of today's generation?
See, while I was the part of that national drug survey, at that time we have got many other chemicals, okay, starting from alcohol, cigarette, cannabis, and all those things, that forms a huge group. But if you ask, then from the COVID-19 post-pandemic era, if I have to say, then it is the behavioral addictions, mostly the mobiles.
So then again, earlier you were saying that addiction can lead to some financial problems, like if you are drinking, then when you crave for drinks or beers, then you tend to spend money, and it can also do a financial harm to that particular individual. So then that particular individual go for stealing, and then these all things continue in a particular chain. So sir, in a way, can we say that all these substance addiction is in a way influencing the non-substance addiction as well? Like, are these both concepts of addiction connected to one another?
See, in both the cases, the problem lies in the brain biochemistry and brain anatomy. That is the reward center. So in some of the cases, we have seen they coexist. But usually people are addicted to one substance, and when they have found that that is not available, then they will take the other. They always have one primary addiction. Then other addictions might be secondary. Okay, so there comes the concept of primary addiction as well as secondary addiction. Suppose a person was addicted to some substances, but gradually he has got other things, but his prime focus is on one.
Okay, sir. So then earlier you also mentioned about some materials which are addictive, like whiteners, then glue, petrol, etc., and the smell of books as well. So sir, this can't be more addictive like drugs and all, right? Because these are some things which we all do. We all
We
love
all
nuts.
do, but see, there is use and abuse and misuse. Na? You have probably when you will visit any of the psychiatrists or any of the addiction psychiatry unit, then you will realize how it is different from the normal behavior. They will take that glue, they will put it in a bag and they will inhale it. They cannot live without that. So that becomes more than what the normal people are doing because we are using that erasers. But we have misused it or we have overused it. We have intended it to get that pleasure. That's why I am doing it, to get that kick. So it is no longer a normal behavior.
So, can we say that if we do certain things in minimal amount, then we can follow with it rather than getting addicted to that particular thing?
That's why the whole concept of use misuse, that thin line. See, use, if you are using it without any harm, then we are not bothered about that. See, everything in a minimum amount or in an ideal amount or an optimal amount is good. Suppose you are drinking water every day. If I say that you will have to drink plenty of water, if I don't specify it, ideally you take 2 to 3 liters of water. But if you think that I will take more water, 10 liters of water per day, even that water becomes a toxin. That water becomes a poison. So that's why that line has to be there. And when it comes to the matter of the brain, usually it is very difficult to control those who are suffering from the problem with their reward center.
Okay, sir. Thank you, sir. I think that this will be a few questions from my side too. So, with this, as we are running out of time, so we would also.
I was about to tell that actually.
So, I would like to.
My emergency actually. All the calls are coming. I have put my phone in silent mode.
Okay, so I would like to end this session on a positive note, and I also hope that all of the people who are viewing us have got some kind of information from this interactive session and discussion. So with this, I hope that we all kind of get to know some very important things which we might not be aware of before. So hope to meet again in a new session real soon. With this, I would like to conclude. Thank you for everyone's presence and good night. Thank you, sir, again.
Thank you so much. Thank you.
It was an honor to have you, sir.
It was my pleasure.
Okay, sir. Thank you.
Thank you, sir. Thank you, Namrata. I'm ending the meeting now. Okay. Good night.
Good night.